All right, should I go ahead and get started? Are we all set?
Yes, thank you.
All right, good morning, everybody. I'm here today to talk about understanding the COVID-19 through the lens of the disabled population. Like Kristen did mention, I'm a community health worker, and I am particularly focused on the deaf and hard of hearing population throughout New Hampshire. That is through the Pearl Health Grant. It's hard to condense in under a minute what I do, but I'll do my best. And this presentation will last about 10 minutes, and we'll have questions at the end. I'll make sure to send this PowerPoint out to everybody, so if you do have more questions or want to reference it, you can. So I've brought up this screen to share the PowerPoint so that I'm able to use this for reference. When I usually talk about a person with disabilities, I say disabled person. Usually we use first person language, a person with a disability, but there are individuals who have specific identities tied to their disability. Sometimes those perspectives on disabled individuals might be a medical perspective or a community perspective. I will use the word disabled for the remainder of this population in the interest of keeping that identity with these individuals. All right, disabilities don't discriminate against anyone. Children, adults, short individuals, tall, different races, from different ethnicities or backgrounds, all individuals can have a disability. For scientific and mental health purposes, when we think about this population, we do see that they tend to be older, maybe coming from lower economic statuses, poorer. There may be other comorbidities happening, and most likely are going to be female. And that's something to be mindful of when we're doing action, when we are focusing on these target populations. Something to consider is older individuals, if they've experienced deprivation, if they have comorbidities going on, and what the increased risks are because of the COVID-19 pandemic. There are so many compounding factors here that can have serious consequences for these individuals. COVID-19 pandemic has impacted people in a variety of different ways. I'm here to talk about this disabled person's lens and their view. A lot of individuals are interested in having a hybrid approach to their healthcare, and that was denied to them until the COVID-19 pandemic happened. There are some cons in terms of the pandemic. COVID-19 has been more catastrophic for individuals who have disabilities because of their conditions. It's not the COVID-19 specific that's caused this, it's just the compounding factors. They're at higher risk for contracting COVID-19. Possibly their caregivers or their staff who are providing services to them, or the group home staff may be behind in what they're receiving for COVID-19. They may be limited in where they can go or who they can be around because of barriers to vaccines. They may be stuck in terms of where they're able to, maintain their health. Those with intellectual disabilities are 2 or 3 times more likely to become seriously ill from contracting COVID-19. Last you'll see is red on the bottom, the crisis standards of care. It's extremely unfortunate that we see that hospitals are quite overwhelmed due to the COVID-19 pandemic. So what do we see in Idaho, for example, is to the point where they have to do rationing care, which means they need to They need to triage who is the highest likely to live in these situations and focusing their care on those. If they are not likely to live, then they are not able to focus care. So those individuals who are at risk tend to be at a lower chance for surviving. And so they may not have eyesight from medical providers in those hospital environments because they are having to triage and prioritize. I'm not going to get into too much in depth about this, but an example of a barrier is 211 for a person with disabilities or a disabled person. If they call 211 to get a vaccine appointment, Greater Nashua may encourage deaf or hard of hearing to contact 211 to get information. And 211 is not able to help them in terms of setting up an interpreter or telling them where interpreters would be. This can be a frustration for the deaf and hard of hearing population because that information is not accessible to them. You might wonder why disabled individuals are not getting vaccinated. There may be a lot of complex issues that they're talking about with their healthcare provider. New Hampshire is doing great with language minorities, but there still are barriers in place. And also there is a history of medical mistrust among disabled people and healthcare providers, maybe not having communication access. There's a long history of doctors and medical providers, trying to sterilize deaf individuals. And so when we talk about the trust between the deaf population and the healthcare providers, that history goes way back. I have talked a little bit about the history, the frustrations disabled people might experience. And so now you might be wondering what you can do. In December and January, we had the first vaccination dissemination real efforts. And so there was some prioritization that happened and we learned some things. Now boosters are starting to be available. And so if disabled individuals are qualified, I encourage you to prioritize them. I also encourage you to work with community health workers to encourage those communities to come in. There are many community health workers out there that can be a liaison to the community and to these vaccine offices that are available. Many organizations out there know that they need to work in partnership with disabled individuals. In Australia right now, they have vaccine appointments for people who are eligible and getting those notifications so that they can get them via text, via email, whatever is most accessible. And so when we talk about autistic individuals benefiting from low sensory vaccine clinics, this is also something that Australia is offering right now. So I encourage you to think about that. The COVID-19 long haulers, you may be wondering what that means. Individuals who have had or have contracted COVID-19, maybe not fully recovering. They might experience symptoms that are long acting. It can be chronic illness and last for years. And there are many people who are experiencing that and some who will eventually become disabled. So that's something to be mindful of. This presentation, really, I want to focus now on the end here. Obviously, my passion is deaf and hard of hearing population. And so there are a variety of resources out there. If you are seeing a deaf person or a person with hearing loss, a hard of hearing individual, I encourage you to contact the resources listed here. Communication Service for the Deaf has a hotline where deaf individuals can get information about COVID-19 in ASL. So I also encourage people to use that resource. I'm also seeing in the chat, yes, these slides will be available. I'll share them with all of you. I think I used my whole 10 minutes. I want to make sure that I have some time left for questions, though. If anybody has questions for me or comments, feel free.
Thank you, DT. For everyone, the floor is open. Feel free to come off mute, or you can put your question in the chat. We're keeping our eyes on the chat so we can share any questions with DT. I think that was a really great presentation. And let me just check the chat and see.
Sure.
Let's see. Yeah, we have some notification that long haul COVID is a disability under the ADA. So I appreciate you sharing that as well. Maybe while we're waiting for other people, if you don't mind, I've got a question. So in terms of thinking about moving forward as we are now with third doses, potentially booster doses based on recommendations. What might be one or two key things that you think the state could do? I'll ask from the state's perspective, but this is probably good for everybody. Could do better that we should be paying closer attention to at this point. We've certainly learned a lot of lessons, made a lot of adjustments, but I'm sure there are many things that we still could be doing much better.
All right, thank you for that question. Let me take down that screen share before I answer your question. Perfect. Oh, I can see people's faces. Great. So to answer your question, the first wave of vaccines that we had prioritized disabled individuals or people, in institutionalized environments, group homes, but those with home providers were deprioritized. If a person lives independently or they have a home care provider and they're living in that environment, they may be limited in what they can do going out to the store, et cetera, because everybody in the home is not vaccinated. So now with boosters coming out, I do feel New Hampshire needs to prioritize disabled people that are living in a home with a home care provider, so they don't necessarily need to go and get in line and wait as long. Staff that are working with disabled people in group homes that are interacting frequently, where are their increased protections? New Hampshire typically is not so big on, government making decisions, let's say, so they kind of empower individuals to make those decisions themselves. But when we talk about individuals, like I said, living in a home care environment with staff among them, how are we putting those protections in place? I encourage New Hampshire to think about that.
Thank you, DT. That's very helpful. We have a question in the chat. The question is from Tori Jennison. How could telehealth change or adapt to better serve people with disabilities?
Sure, that's a fantastic question. My answer is also going to apply to rural areas and rural healthcare as well. I think increasing accessibility is a phenomenal idea. New Hampshire tends to be a little short-staffed when we talk about interpreters all over New Hampshire. So if somebody's in the northern country and they have an appointment, their access to interpreter may be limited. They may go ahead and want to have a telehealth appointment because an interpreter is available. I have some clients who live way up in Hebron or over in Rochester, some who have been in Berlin, where our office is in Nashua. And so for them not having the best access to services. And so the way we can continue to support them is through telehealth. So occasionally we will, meet in person, but having that telehealth accessible to all areas of the state. Individuals who are worrying about transportation, having to depend on a bus system, if they have a wheelchair, if there's an elevator that's broken, all of the stress that's compounding, if they're able to stay home and access their healthcare providers from a telehealth appointment, I would encourage rural areas to really explore this option.
Wonderful, thank you. I do see a note from Bobby about home visit vaccination appointments. We also do, I'll talk a little bit more about this in the update. We do have that service available. Well, I'll talk more about what we have from the state perspective in the update, but Bobby is offering that if you're in the greater Nashua region, you can call to schedule an appointment. Her number is in the chat, and thank you, Bobby, for sharing that. Do we have any other additional questions for DT?
I did have something that just, or actually, if something comes to mind later on, my contact information is at the end of the PowerPoint. Please feel free to contact me anytime with questions.
Wonderful. And we will, the recording will be available. And I'm not sure if we send out the slides separately or as just part of the recording